Is your gut feeling good today, or do you think there might be something wrong? Today, we're going to talk about the 7 warning signs of colorectal cancer, and it's crucial to pay attention because this is the third most common cancer and the second deadliest. About 10% of all cancer-related deaths are caused by this tumor. So, be sure to stay until the end of the video to understand everything, and don't forget to subscribe for more health insights that can make a difference in your life. Let's begin by dividing this video into 2 parts. In the first part, we'll discuss the symptoms of colon cancer, what to look for, what you can physically see or feel that might indicate something is wrong. In the second part, which I believe is the most important, we'll talk about prevention. What can you do to reduce your risk? What habits should you adopt, and what foods should you eat to help prevent this disease? I'll also discuss polyps and why colon cancer is becoming more common in people under 50. This video is packed with valuable information, so stick around till the end. Have you or anyone you know ever dealt with colon cancer? Where are you from? Comment below. So, what are the 7 warning signs you should look out for if something is not right in your intestines? The 7th symptom is changes in bowel habits. It's important to be aware of your usual bowel routine. Some people go right after breakfast, while others may go 2 or 3 times a day, and some might only have a bowel movement a couple of times a week. What is your normal habit? If you notice changes in your stools, pay close attention. Bowel changes happen to everyone, but they aren't always a cause for concern. However, if these changes persist and worsen, it's time to see a doctor. Around 65% of people diagnosed with colorectal cancer experience changes in their bowel habits. These changes can differ from person to person, depending on the size, location, and stage of the tumor. You might notice differences in the consistency, color, or frequency of your bowel movements. Some people may experience more frequent diarrhea or, in other cases, may go less often. If you experience diarrhea that isn't linked to a viral infection and lasts for more than a few days, followed by constipation and then more diarrhea, that's a significant change and needs medical attention. The 6th symptom is blood in the stool. This is why it's so important to pay attention to your stools before flushing them away. What type of bleeding should you be concerned about? The large intestine is divided into several sections: the ascending colon, transverse colon, descending colon, and sigmoid colon, followed by the rectum and anus. The right side of the colon is wider, and stools here are more liquid because the colon absorbs water. Therefore, if a tumor develops on the right side, in the ascending colon, there are usually no symptoms of obstruction, but it may bleed more often, causing anemia, and stools may turn black and tarry, known as melena, which has a foul smell. On the left side, where the descending and sigmoid colon are smaller, stools are more solid. In this area, you might notice bright red blood in the toilet or on the toilet paper. While other causes like hemorrhoids, anal fissures, or even eating beets can lead to red stools, it's important not to assume it's harmless. Blood in your stool must be examined by a doctor to rule out anything serious. The 5th symptom is abdominal pain. If you've never experienced stomach pain before but now suffer from frequent cramping, or if you feel pain during bowel movements, this could be a sign that a tumor is affecting part of your rectum. While it could be caused by something simple like gas or a change in diet, if the pain persists, consult a doctor. The 4th symptom is fatigue. Not just the tiredness you feel after a bad night's sleep, but a fatigue that lasts for weeks or even months. In the case of colorectal cancer, this fatigue could be due to hidden anemia, as tumors can bleed slowly, causing your red blood cell count to drop. Even if you're eating well, a tumor can sap your energy by consuming nutrients, leaving you feeling weak and chronically tired. The 3rd symptom is bloating. Bloating or abdominal swelling can be a common sign of colorectal cancer for several reasons. The tumor could be partially or completely blocking the intestine, causing gas and stool to build up. This excess gas can cause cramping and discomfort. If you experience frequent bloating without an obvious cause, it's always better to check with a doctor. The second symptom is unexplained weight loss. If you're not dieting or exercising more but suddenly lose weight, say, you drop from 70 kilograms to 63 kilograms without explanation, it could be a sign of cancer. Tumors can interfere with the body's ability to absorb nutrients, or they can produce substances that reduce your appetite and increase your body's energy expenditure, leading to muscle and fat loss. And the most important symptom, the first one, is the feeling that your bowels aren't fully emptied after a bowel movement. This sensation is called tenesmus. Even after going to the toilet, it feels like something is stuck, and you need to go again. This could be because the tumor is partially blocking the intestine, causing stools to be ribbon-like in shape as they pass through the narrow opening created by the tumor. But don't panic. Many people with early-stage colorectal cancer show no symptoms at all. That's why it's so important to be aware of your risk factors and consider getting screened, especially if you have a family history of the disease or other risk factors. What are colorectal polyps, and why are they important? Most colorectal cancers develop from polyps, which are abnormal growths that line the colon wall. While not all polyps become cancerous, some can, especially if left unchecked for about 10 years. That's why regular screening is essential. Several factors increase your risk of colon cancer, including age, inflammatory bowel diseases like Crohn's or ulcerative colitis, genetic conditions like Lynch syndrome, and a family history of the disease. But some risks are within your control, such as smoking, drinking alcohol, a sedentary lifestyle, and a diet low in fruits and vegetables. Processed and red meats also raise your risk. With colorectal cancer rates rising among younger people, organizations like the American Preventive Medicine Society have lowered the recommended screening age from 55 to 45 for people at average risk. Now, let's talk about prevention. The final and most important section of this video gives practical advice on how to reduce your risk of colorectal cancer. First, stay hydrated. Drinking plenty of water helps keep your intestines functioning properly and reduces constipation. Second, eat more fruits and vegetables, especially those high in fiber. Fiber helps move stool through your intestines quickly, minimizing the time toxins stay in contact with the colon wall. Third, use natural anti-inflammatory foods like turmeric and cinnamon, which can reduce inflammation in the body. Fourth, consume dairy. The latest research suggests that milk, yogurt, and cheese may help protect against colorectal cancer. Fifth, exercise regularly to improve digestion, regulate hormones, and reduce inflammation. Sixth, avoid alcohol and tobacco, as both significantly increase your cancer risk. Finally, get screened regularly. If you're over 45 and at intermediate risk, it's time to consider a colonoscopy.